Hello. Today I am doing a session on post-surgical, what to do, what not to do. It's very important to remember some of these points and do it according to what type of surgeries you are having. First rule that I usually tell people after having a major surgery or even a minor one, if you go under anesthesia or even epidural, I'd rather you not drive. I'd rather you have someone pick you up and drop you off. Your reaction time is a little bit more slower. Your blood pressure is going to vary. There are many multiple factors. And they may give you a medicine that changes your vision sometimes, and it is better off to bet and think that you were dehydrated because you were probably not allowed to drink fluids much during the process. So try to understand these protocol, try to understand that, and try to remember to have somebody always with you when you're right after surgery. Number two is keep the wound dry. They give you antibiotics to eat, make sure you take them. Keeping the wound dry or following the procedure, what the doctor says, is so important. If there is a bandage, don't take it off till you go to the next doctor's visit. They will actually do a good job of keeping that bandage over there keeps it sterile. So the more the sterile the wound site stays, the better it is for your healing process. Some people are allowed to take bath. Some people need permission not to take bath. 90% of the time, they tell you to saran wrap the joint or keep it so that the wound is kept isolated from water. Okay. Next, number three, do not lift. So depending on the type of procedure you have, if it's an abdominal surgery, cardiac surgery, shoulder, you do not want to lift. Even some pelvic surgeries, they don't tell you to lift. The reason being, you may not feel the pain after week 10, week 6, because the nerves might not be infiltrating properly in certain areas. When you don't feel the pain, even after week 6, you're going to push a little bit or exert a little bit more because you feel better and the wound looks superficially dry. On a tiny person, yes, it's true, but on bigger people, the wound may look superficially dry, but inside it might be hissing. That's literally what I have seen it look. It looks very angry. So give it a chance to rest. Give it a chance to heal first before week 10 is over. Then you will have a better chance of single limb activity, a little more safer. 50% weight bearing is usually allowed by a certain time when the bone shows that it is healing, but you have to listen. Your doctor is the only one who can clear you for that, and wait for the doctor to say. There is a true story. A patient told me that the doctor said they could walk inside the house. The patient did not hear inside the house part and decided to walk 5 miles. The patient was taken back to surgery immediately because and had to be refixed because they pushed past the point of pain and they hurt the stitches. And that is extra longer time of recovery. That 12-week period sometimes end up being another 12-week period, and you don't want that. And some people, if you follow the protocol, the first 3 weeks, you're usually out. So you don't have to keep the protocol depending on the type of surgery you're having. Cardiac patients, they're told to keep their head up, bed up. Depending on the angle of surgery, they are sometimes told not to roll. It's very important to remember that, and keep your bed set up in a way you can get off without using your arms. You put pillows under the mattress or sleep in a chair, however it is that'll help you to do better. Not a chair, a recliner. So you have to follow what is important. Abdominal surgeries, they usually tell you, do not exert, try not to pop the stitches up. You have to follow those protocols, okay? Even with weight loss surgeries, they specifically tell you you can use weights at a certain time, otherwise don't use it. Next, number 4 we're going to talk about is constipation. Most pain medications do get you constipated. And number 2 reason that they're constipated is they're not drinking enough water. Number 3 reason why they don't get enough, they get too constipated is because they're now walking. When you are walking every day, for every 1 hour, you get up and walk around the house. you are actually helping the GI to be increased motility, and it feels better when it's learning to stand up tall. It helps the gravity to move things a little bit more easier the way it's supposed to move. So it's very important. Oh, another important reason what happens is as you're walking around the house, say 5 minutes, you are actually helping the fluid to move around in your body. So the lymph systems make their own mechanism by using the push-pull system of the muscles to pump the fluid away from the surgery site. So it's good to get up and walk every hour. So it'll help you. All right. If you're constipated, you could eat soluble fibers that will help poop to go out easily. There's grits, cereal, oats. I found a really nice fun one. If I will show in the end of the session, or you could eat 30 prunes. It's your choice, or you could have a Metamucil. I usually have to tell my patients the importance of walking. I would say you could walk, or you could eat 30 prunes, and usually they'll be like, I don't want to eat 30 prunes, and they'll go back to walking. It usually is the easier way. When you're walking, your bowels actually get regulated very easily. And if having to choose what will take my pain away faster, it's constipation. If you remove it, you will actually feel better. Diarrhea. Some people, when they're on right after surgery, they may have diarrhea. It's a normal reaction depending, because your body's not used to all the trauma and it's trying to figure out what's going on. When you have that, remember to have water, drinking water. Have vitamin C, because most women will have a UTI, which is normal. So eating vitamin C is important with it. And if you're too loose, you're going to get exhausted. So you want to have caffeine. That's the only time that I say have a cup of coffee. At least it'll make you to go. But if you're not drinking water, it's a double-edged sword. I'll talk about that a little bit later too. And when you're having that caffeine, you can have some salty chips, because when you need to replenish the sodium in your ions in your body, and sodium is number one that goes. Sodium and potassium goes out of your system really fast. So you want to replenish those things. If you're hydrating, then you're allowed to eat sodium usually, salty stuffs. So it depends on what your blood level looks like. Ask the doctor or the nurse that is caring for you, and they can guide you how much you're allowed to and not allowed to. Hydration specifically for kidneys and for hips, for hearts, not hips. It is important to follow the fluid restriction, because it has such a big impact on edema that is bringing into the body systems, okay? And remember, the more you stay in bed, you are getting weaker. So it's important that you get up and walk every hour, so that the edema that is staying on your body gets pushed around the body a little bit more easier, and it becomes lighter weight. Otherwise, you're solidifying it into 10 pounds on your body. All right. Another important thing to talk about is ice. I am a fanatic ice pusher for everybody. How to use ice in other countries, I would say, is put in a double plastic bag so the water doesn't come out. After you put in a double plastic bag, you seal it completely. Make sure you put in a pillowcase. The moisture from the outside of the plastic bag should not be on the wound site at all. That is the purpose. Humid countries are different from northern climates, so you have to base it on that. Do not put on any skin point more than 10 minutes the wound, the ice, not the wound. That will help the fluid to move away faster, and you prevent and help move it around a little bit. So usually what I tell my shoulder patients is 10 minutes keep it on the front area, 10 minutes keep it on the side, 10 minutes keep it on the scapular area, 10 minutes keep it on the neck area, because you have a duct here and that can open up and move the fluids out a little bit. All right, so it helps it. For the knee, it's the same thing. For a bigger person, it's a little more easier. For tinier persons, I would say keep it on the top of the thigh, keep it on the bottom of the thigh, keep it on the back of the bottom thigh, but keep it on the above knee, the knee area behind below the knee level, keep it there, and then move it back to the surgery site. that fluid can pile up all around. There's so many insertions and origins of muscles over there. So you are helping out by putting that 10-minute ice on different parts of the knee joint area, okay? It helps move it easier too when you have to walk to the bathroom because you're drinking good. Let's see. One of my favorite lines that I heard from one of the neurologists is, medicine is dumb. When he first said, I'm like, why would he say that to a patient? I used to think in my head, but then he was right. Medicine can move in your body only if the arteries and veins can move it. And if your arteries and veins need to move it, the muscles need to work. And for the muscles to work, guess what? Move the fluid around that muscles and everything, you need to walk, get up and walk. So every time you're walking, not like overtly, but every hour, just get up and walk inside the house one time and come back. You're actually helping move that medicine a little bit more faster because the lymph is moving around, okay? And you're helping the heart because guess what? When the pain goes out, the heart's really angry. It's gonna remember the pain. So I want you to lower the pain by getting up and walking, okay? A little bit every day. Right after surgery, you probably only could walk to the bathroom. Then the next time you walk 2 times to the bathroom, okay? That one trip, you walk, go pee, come back to the bed, and then go get up and walk to the toilet and back again. So the next time you get up, you go 3 times, you know, walk, go pee, come back, and then do it 2 more times walking. You add each time, and that kind of helps develop your, prevent you from having muscle weakness also, okay? Alrighty, most important part, hydration. Like I said, it's a double-edged sword. Cardiac patients cannot drink it. Kidney patients cannot drink it. So there is an amount that is allotted by those doctors or nurses that tell you, okay, how much you're allowed to have based on the weight gain, based on the way the sodium and the potassium is moving around your system, depending on your blood pressure medications or the diabetes, all of the above. So it helps when you remember your body is 80% fluid. You lose 1 cup of fluid through your nose. Okay, that's 8 ounces of water you lose through your nose for an elderly person. So if you're losing that much, and then if you are a mouth breather, which is all of the cigarette smokers, 63% more can be added on. Now, I haven't talked about the other parts of the body that you lose through even. Now, your skin needs to be kept protected also, and that is done for the with hydration, proper hydration system. If you have eczema and all that stuff, and you are not hydrating enough, you are letting it, you know, water seep out easily through those areas. Can you imagine if you're having a surgery also, you're not taking care of your skin, it becomes such a big deal. I have a whole YouTube on how to massage, how to make the nerves to relax, even though it's under anxiety. I highly recommend it for calming the vagal nerve. The vagal nerve is such a trigger point at surgery time because, you know, the heart has to listen to your brain and it doesn't see exactly what the brain is seeing. You know the surgery is successful. You know you gotta move, get up and move only if you're allowed to. Are you supposed to keep it not weight bearing? Then you should follow the precautions that are being told to you. Another important thing that I forgot to say, oh yes, with water, I found this personally for myself. Every cup of coffee I drank, I took 2 cups of water also added on to it so that I did not get dehydrated. And because of this method of, if I drink my 2 cups of water, I could have a cup of coffee reward, I was always hydrated 1 step ahead of everybody else. And because I'm a, you know, like I said, when you're working, you come home, you're doing the household activities, it is harder to hydrate for yourself. So you have to do a reward system. You want that cup of coffee, drink 2 cups of water. You want to get a good bowel movement, get up and walk around, okay? Eventually, you want to be able to go to a physical therapist and get realigned what your muscles are weak on and what they're not. Believe it or not, even I need to be corrected in how my muscles work by another therapist. So I totally recommend you seeing a therapist that's local to you and learning what you can correct. Sometimes it is amazing how each person, what works for one person may not work for the other person. But I don't tell them that because it'll be a big issue for them. because I have I would like to do what my other friend is doing, basically, is the thing that I grew up with. Things that there are food materials that help you to hydrate. That's the important part that I forgot. There is melons, there is lettuce. All these things contain a lot of water, so they do hydrate your body a little bit more. Now in London and all, they have water tablets. Okay, so you can, if you're taking that water tablet, you don't have to drink that much water. For those who hate to drink water, that is also another option. Now another important thing that I usually teach people about is food. If you Google up alkaline food, you will get a lot of stuff. Back in the 60s and 70s, I never had to tell somebody, keep your body alkaline. It's not, we were eating healthier. I don't know what happened. I don't know, is it because sugar is more easier available? There is more goods, pastries and all that stuff. People need to eat healthy. So alkaline food is watermelons, nuts, anything. Google it up and find them and make sure you add that into your body systems. Wound tends to heal faster if the body is alkaline, and actually your body actually metabolizes a little more better to heal itself. And remember, there's turmeric you can take for to help reduce the inflammation, but you need to run it by your doctor and see if you really need it, because if they have you on something, that'll contradict, because medicine changes daily, according to me, not to somebody else. And it is good to have that knowledge. And I am one of those people who try to incorporate naturopathy and medicine. They go so much together. In Kerala, we have naturopathy, we have allopathy, and we have Ayurveda. We need all three to raise a child sometimes, because the systems work differently, cultures work differently, and it does come together, and it's so beautiful. The kids are not, their intestine is working healthy because of Ayurvedic treatment sometimes, and they need the allopathic medicine also at the same time for other stuff, and you have to find that balance. So you are the driver of your body systems. So I want you to be proactive, to be healthy. Okay. All right. Thank you for listening. I will come up with more ideas. Oh, forgot to tell you, I found this in Aussie. I am an addict of Aussie, of course, because I have a vegetarian in my house. So not just me, I have another vegetarian child. So I found this. It's by Green Max. It was amazing because it's got red quinoa, black soybean, walnut cereal, and no sugar added. Okay. I wish this was written in English so I could tell people, but it's not. So I like this because it is very soluble fibers. It is alkaline, and it's estrogen for women about 40, which you need. So I recommend it to everybody. It's a little packet that comes inside that. It goes with a glass of milk. I'm telling you. Look at this. Breakfast is ready. It's only you boil it. You can put in a kettle of water. It has pictures, so you can boil the kettle of water and you put the powder in it and you stir it. Of course, if you want honey, you put honey. All right? All right. Have a wonderful day. Take care.